So I'm going to be talking about adherence issues, safety, and adverse events. It's sort of my bailiwick, kind of addressing these things, making sure that they're clinically relevant and appropriate and safe. And what I thought I would do is, first of all, I guess I'll sit down, revise the order of that sequence, to start off with safety, and then go into adverse events, and then adherence. Because I see safety as one of the key things we need to pay attention to in a clinical trial, and adverse events comes out of that, and then we can talk a little bit about adherence. And I would say feel free to ask questions. We can have some discussion if you want, but also if you would prefer to write down a question, that's fine too. And I have to say, I'm going to be pretty frank if I don't know the answer, because we're still working out some things. I don't know if anybody else has said that, but I'm gonna say it because it's true. So safety considerations for this trial involve aspects at eligibility and screening, as well as follow-up. And at eligibility and screening, the safety considerations include the exclusion, some of the exclusion criteria, not all of them. Some of the exclusion criteria are so that they don't sort of conflict with the intervention. Some of them are to encourage ongoing participation, that sort of thing. But many of the exclusion criteria are focused on safety issues. We also have alerts for some of the measures that are taken. And then the consent also addresses safety issues. At follow-up, we also have alerts so that when you're doing physical measures, if certain readings are found, we have actions that you should take in order to ensure that the participant is safe. We also have an informational handout that's still in development, but the plan is that you would provide that to the participant each time study pills are dispensed. And that is a very nice, it's going to be a kind of a nice little booklet that is sort of her kind of Bible for the trial, which tells her, in addition to the consent, but it sort of tells her about the study and things to watch out for and things that are expected, so it's a nice reference for her. A management and safety interview, which is still in development. You can tell the things that are in my lap because they're still in development. But a management and safety interview, and I use the term management as opposed to adherence. You might have seen in some materials that it says adherence and safety, but I would encourage you to focus on this title, because you don't really want to, slip up and say to a participant, I'm going to do an adherence and safety interview. And so this is a way to just sort of convey that you're trying to help them manage the study pill regimen, the potential side effects, and address their safety. And then another safety considerations is at the closeout tapering study pills if they're taking 2 pills a day. And I'm assuming you've gotten the sort of sequence of events so that you know that at the 8-week visit, if they're taking 2 pills a day, they're going to taper, and otherwise they can stop their study pills right away. So basically, some selected exclusion criteria that are more focused on safety are that they're excluded if they're not in general good health. And although that's it's actually listed as an inclusion criteria to be in general good health, and a lot of the safety exclusion criteria are focused on ensuring that a participant is in general good health. If their blood pressure is 160/100, they're not eligible, but we do have a sort of a midway range that if their blood pressure is between 140 and 159 over 90 to 99, they're still eligible, but they need to be informed that their blood pressure is high, and recommend that the participant follow up with their primary care provider. I know that some of you are not clinicians, so if I'm using terms that seem like they're coming out of left field, please don't hesitate to stop me, and don't be embarrassed about doing so. I will try, as I have some of these clinical abbreviations, to say them out, rather than using the abbreviations. The resting heart rate, if it's over 110 beats per minute, is also an exclusion criteria for the study. For medical history, again, it's this issue of in good general health. So if they have liver disease, gallbladder disease, renal disease, or uncontrolled seizure disorder, they're excluded. And in part, this is because escitalopram has been associated with potential concerns about liver metabolism and that sort of thing. And so these are measures that kind of give us some hints about that. Also, psychiatric history is an exclusion criteria in terms of if they've had a suicide attempt in the past 3 years, a major depressive episode within the last year, or a lifetime diagnosis of psychosis and bipolar disorders. Those items are on our study forms. Sort of, at times it might seem buried, but our database, as you probably know, will scan for those exclusion criteria to assess those. There is a protocol if a participant, even at the time of screening or through follow-up, is expressing suicidal ideation. And basically, we are not assuming that the people who are kind of administering those forms are like advanced clinicians. And so for you, if you pick up something like that, you should have identified at your clinic a clinician and ideally a referral psychiatric clinician that you could refer the participant to, who could do a more thorough assessment of their potential for suicide if they are filling out the forms indicating some sort of suicidal ideation. So I guess I want to allay some concern on the parts of staff about needing to treat suicidal ideation, but we do need to address it in the course of the study, and that there are procedures in place to ensure that participants are taken care of appropriately. Other exclusion criteria include the use of psychotropic medications, and I'm going to mention one class of drugs in particular, and that's NAO inhibitors, is an absolute exclusion. But there are other interactions with some of the psychotropic antipsychotics, some anxiolytics or anti-anxiety medications, and so we ask about that during the screening. Pregnancy is an exclusion criteria. Escitalopram has not been tested adequately in pregnant women. And so for the purposes of this study in particular, we're really being very careful. So you've probably heard that pregnancy tests are going on at various points in time to make sure that the participant is not pregnant. And she's being given instructions about using appropriate birth control, and that information is in the consent form, and it's going to be in that study handbook that I told you about. So another exclusion criteria is if she's not using birth control and yet she's of childbearing age still. And so you will be asking her about that on the study forms. And then if she has a known hypersensitivity to escitalopram or citalopram, that would also be an exclusion. Have they had the lab? Yeah.
Not yet, no.
Okay, well, that's coming up. More fun and games. So you'll be drawing blood, or somebody at your clinic will be drawing blood for labs, and you'll be drawing two different types of specimen. One is for what you might hear as safety labs or eligibility labs, and the other is for the repository. So the safety labs get processed and analyzed right away so that we can determine if the participant meets the eligibility criteria, whereas the repository labs are processed and sent to the repository for storage and future analysis. These are the safety lab values above which a participant is not eligible for the study. Or in the case of the blood count, the hemoglobin and hematocrit, if they're below those amounts, then the participant is not eligible for the study. And there's a couple of reasons. Again, the liver function, kidney, relates to this concern about metabolism and kidney flow and that sort of thing. There's also been some incidents of hypercholesterolemia in association with escitalopram, so we're looking at total fasting cholesterol. And then the total fasting triglyceride and blood count is in part just to ensure that general good health of our participants.